Hi, Professor. So this is me trying to get everything into frame. Sorry about the little bit of confusion, actually. Hold on one second. And I've got you flipped around. Sorry. So Heisman again, and now we're going to do just examining the peripheral system, okay? So the first thing I'm going to look at when they're laying down is I'm going to look just and inspect both sides. I want to feel up and down, noting any coolness. It's supposed to be warm and dry to the touch. I'm looking for any obvious drying of the skin or shiny patches or places where they may have lost hair, because hair loss actually in patchy areas can indicate poor circulation as well. And I want to compare both sides at the same time as well as individually, because what may be normal for one side doesn't necessarily mean it's normal for the other side. So it's important to compare on both sides for a patient. So I'm going to do one arm at a time so you can actually see what I'm doing. So I'm going to be looking at his hands, noting asking about any pain in his fingertips, if he's had any tingling going on. You know, when you kind of hit your elbow and you get that tingling sensation, have you had anything like that going on, or any pain in the mornings? A lot of times, especially when they're starting to get peripheral vascular disease, they'll get a lot of pain in their thumbs. I've noticed that just on working on different floors. And then I'm going to check for capillary refill, which it should be 1 second or less, realistically. And it looks good. Now, normally, this isn't necessarily included, obviously, in the peripheral vascular system, but it is something important that I like to note. I would actually normally also check just for whether or not he's hydrated by tinting his skin. The reason why I like to do this is because if a patient's heartbeat is particularly fast and the peripheral vascular system seems to be a little bit slower than normal, or their capillary refill, that can actually also be an indication of dehydration. So if I'm worried about something being wrong, I also want to rule out things that could also be wrong and be affecting the same symptoms. So that's why I like to look for dehydration. Are you doing okay? Okay. And then I'm just going to feel for radial pulse. And then I'm going to go up to brachial. I'm hoping you can see me. I know the light is really odd in this bedroom, which is why we're not trying to film most of the stuff in the bedroom, because the light's extremely hard to see, so I'm hoping that you can see most of this. And then you can also listen as well, auscultate, and you should. We're looking again for bruits, thrills, anything abnormal for this area. Great. And everything seems to be normal. And of course I would compare this to the other side. And I would listen as well as obviously palpate for both. Do you mind flipping to the other side so I can show her the legs? Okay, perfect. So I actually need you to go. It'd be easier at an angle, almost. And then she needs to be able to see almost your entire leg. Okay. So I think you can mostly see this. Okay, perfect. Sorry again about the weird situation. So now I'm going to be looking at both sides. I'm going to feel the feet for any particular dryness, and I'm also going to be looking particularly for edema, pitting edema. If I'm looking at for vascular disease, a lot of times when I'm pressing my fingertips in, they'll leave pit marks, and it's called pitting edema. Does it tickle? And that's another thing, you have to be careful with the patients and ask them if what you're doing is tickling, because you don't want to catch a foot into your body. And you can also check capillary refill on these, although with feet it's generally a little bit slower to refill, especially if they're particularly cold. Oh, one thing I didn't mention that I need to mention, when you're looking at the radial and brachial, and the same when you're doing the femoral, or the tibial, you're going to be rating the pulses -2, -1, 0, 1, 2. So you're going to be kind of notating whether or not there is little to no or very loud, strong sounds as far as the pulse goes. Okay? Okay? So I'm going to feel back. I'm going to take both hands, feel for pulse. Good. And then I'm going to come down to the foot and feel for a pulse here. And then I'm going to go to the and I'm going to feel as well here. And I'm going to do that on the other side as well. Feeling the top of the foot, behind the ankle, and behind the knee. Another thing that you can look for on the toes is the same thing with the arm here. If you're seeing any great patches of skin, that can indicate poor peripheral return. And the toes as well, you want to be looking at those, especially, this is especially important with anyone with blood pressure problems and history of diabetes, and renal disease, because although those don't necessarily involve all the time heart problems, they can compound heart issues. So it's really important to pay attention to feet and the legs and really be documenting those pulses correctly and comparing them on both sides, because like I said, what you could think is a +2 on one side could actually be a +1 or not correct when comparing to the other side. You're done. Thank you. Sorry again about having it go in opposite directions, or sorry, having the video be split up in two. Okay, and then I'll be giving you Unit 8 soon. Thanks, bye.